People who suffer addiction get better with treatment. Treatment works. It doesn't require the patient or the person to even understand how treatment works, believe that it will work, want it to work sometimes. It will work if they participate in treatment. I tell patients this is just like taking an antibiotic or taking penicillin for a cold. You don't have to understand how penicillin works. You don't have to want the penicillin to work. You don't have to believe that it will work. You just have to take the penicillin. If you will participate in treatment, if you'll come to treatment, eventually the willingness comes if there's a resistance. That's not a problem. That's not an obstacle. People are ambivalent about change. They're always ambivalent about making changes in their lives if they're really seriously thinking about it. I've had a lot of experience where working with people who are ambivalent, who are suffering, who are sick, and with treatment they get profoundly better. You measure success by the long-term results that you get. Somebody who comes out of treatment and stays sober for a week and relapses, well, is that a failure or a success? Well, it depends. You know, sometimes people do relapse. That's a big part of addiction. And that's often sometimes given as, well, it's not working because people relapse. We see it more as a trend. We work with people and they begin to identify that they have a problem and they start taking action on it. And they may use again, they may relapse, but they overall begin to improve their functioning, their skills, their access to treatment, to health. It's still true that when people start to begin the process, the earlier they begin it, the more likely they're going to be eventually reach a point, the goal, which is recovery. Watching people recover from an illness gives you hope if you practice medicine. If you have a disease and you treat people and they get better, that's a great thing.